Today I'll be showing you how to take bite wings and some tips and tricks. First things first, we're going to have to get our patient ready. They came in all dressed up. Once the patient has removed their earrings and their necklace and any other things, we're going to look inside her mouth to make sure that there's no missing teeth or anything else that we'd be surprised by. As you can see, we've already placed the lead apron with the thyroid collar. And the proper way, I'm going to bring our tube head so for the molars, I don't know if you, for the molars, we're going to line up. Now, for the molars, you're going to want to line up the outer part of this with the plastic. When they bite down, you're going to want this part to be vertical with what they bite down on the sensor, that plastic piece. And the horizontal one, you're going to kind of want to be on the outer part of their eye, so that way you can get the back molars and part of the premolars, and you can get that molar shot. So you're going to just want to kind of keep there. Obviously, the patient I'm working on is not able to give me positive feedback or negative feedback, but I will say a few things. If you have a patient who does not like the sensor and is very, very sensitive, if they seem capable enough, if you leave the room to take the x-ray, you can have them sometimes take it out of their mouth and hold it, just that when you come back in, and you can take it from them and replace it. This won't work on all of them, and I wouldn't recommend it on small children or people who seem not fully there. Also, if that is not an option, you can have them maybe tap their foot or move their hand a little bit. I would refrain them from counting the alphabet out. That might not be the wise
Okay,
idea.
for this next part, I'll be using my mouth, so I will be doing a voiceover, and this is what my sensor looks like that I'll be using. This is kind of similar to what we use for bite wings. It's a little makeshift, but it'll do. So first, when you put the sensor in your mouth, you're going to want to put it somewhat in the center. You don't want it touching the teeth, and you're going to put it in at an angle. And the PID is going to kind of be positioned on the outer part of my eye. Oop, and you forgot to ask them to smile so you can show them what teeth you're seeing. And once you've gotten that molar shot, then you're going to go to the premolar shot, and you're going to kind of want to line it up with the inner part of your eye, that center of that PID, that horizontal. There you go, because you're going to have the vertical line up with the plastic part that you bite on. What I was talking about earlier about making sure that you get the mandibular teeth, I will show you better on Dexter. You take the sensor, and most sensors won't be this large. You're going to pretend like there's a line between here that is hitting the center of that, and that'll help you line up your molar shots. And for the premolar, you're going to do the same. You're going to want to pretend that there's like a line through here, and you're going to want to pretend that through there that there's a line, and that'll help you line up your shots a little better. Possibly the one thing I almost forgot to say, the most important, is when you go to place this in the mouth, you're going to want to tell your patients to bite down slowly, because people are nervous and whatnot, and if you don't tell them, they might accidentally get your fingers. Not all bite wings have all this room for you to have your fingers, so most of the time you'll have your fingers in there, and you'll just hope they don't chomp down on them.